Hello, everybody, and welcome to the Better You podcast sponsored by LAMCO Wellness. Last week, we talked about overdose and what to do when somebody's life may be in immediate danger. Today, we were going to go a little bit further upstream and talk about substance use and addiction, and why it can be so difficult to stop, and I think most importantly, what we can do to help people recover. Our goal is for you to leave this conversation with more understanding, less judgment, and more hope. Uh, so, without further ado, I'm going to introduce Ravi Patani and Dr. Tracy Tilton. And Dr. Tilton, if you want to get us kicked off with, so what separates substance addiction from we're all addicted to something in some way, in my opinion. But what specifically is so, for lack of a better word, toxic about substance addiction?
Well, with substance abuse addiction, um, people keep using like in a chronic way, in a compulsive way, despite the serious consequences to their health, to their relationships, to their work, to everything that people have, all different types of relationships and their own health. It's categorized as a medical disease. Um, So, a lot of people think that it's like a moral failing or some kind of character flaw, but it's a medical disease. And so to be treated, most people some people go to rehab so they can like either detox or just, be in an environment for, say like 30 days where it's they're, in a contained space where they spend all their time working on their addiction. So, and addiction, it changes your cellular makeup. So then, especially with alcohol use, so you don't you're aging your cells and you're also like changing them. So like with alcohol, they're like, where's the alcohol? Where's the alcohol? And that's where you get the cravings because they're used to having some alcohol in them. And then the cells don't. And that's when people get, uncomfortable physically and mentally.
I mean, that makes sense. You know, I've known a few addicts in my time, um, and I've never, I personally have never seen, a clean break from the addiction, if that makes any sense. Like, I've never seen somebody just be like, okay, I got to stop this, and now I've stopped
Yeah.
it, and we're good. Um, it's always, maybe a little bit of back and forth. Maybe I've seen someone very intentionally wean themselves off to nothing, which was kind of a pretty cool thing to see. Um, I've seen somebody kind of do the Tom Holland approach of like, hey, I'm drinking a lot, I'm going to stop for a little bit, and then kind of realizing how much it controlled their life and deciding to continue. But I've never seen someone recognize the addiction, um, try to stop usage, and then successfully stop usage immediately.
But there's also a harm reduction theory that if you, instead of doing like, cold turkey or going, um, you know, using either cold turkey or like in rehab or something, that you just like, if you're going to go drink, then you take an Uber home instead of drunk driving, or you use only, maybe you just use marijuana instead of, cocaine and alcohol or something, just to try to reduce the harm that it does to your life. So that's one theory you can do.
I mean, I already know that there's probably a ton of people who are against that theory,
Yeah.
without
Oh,
even
totally.
looking anything up. But on the other hand, to kind of give equal weight to to this, it does make sense. Like in
Mhm,
personal experience, I think conceptually it's kind of hard to wrap my head around, but like
mhm.
in personal experience, uh, you know, that is with some of the addicts that I've talked to and dealt with, that is the best case scenario that's in front of you. You know, like the
Yeah.
cold turkey and the quitting and just getting them sober is not, it's not on the table right now. You know,
Well,
maybe it will be in the future, but right now that's not
yeah.
happening.
Yeah, and, another piece of the harm reduction, process would be, like, say people are drinking, like, vodka, which has 40% alcohol, and then there's, like, wine with
Mhm.
12% alcohol, and beer usually have, like, 5 to 7, like, craft beers have 7% alcohol, but regular just a normal beer, like Bud Light or whatever, only has 5%. So some people are like, "Okay, I'm gonna stop drinking vodka or liquor, and I'll just drink beer." So that's some people's approach to it. I don't know how effective that is or if that's the recommended way to do it.
I had a family member um who, like, that's their slowing down. You know,
Yeah.
they'll be like, "Oh, I got in a lot of trouble. I need to slow down. So I'm gonna just drink beer now and I'm gonna just smoke weed rather than everything else." And I mean, it's a mixed bag for me because it's like, well, it is a step in the right direction, but I also know that you're only there until you feel like you can go back to full tilt drug addict. Um, so like I see both sides on the harm reduction. Without even researching it, I know it's a debate. Like I know that there are people on both
Right.
sides of this, but I feel like I see both sides because on the one hand, harm reduction is great. Getting somebody to be less harmful to themselves and others is ultimately the goal. On the other hand, you know, it kind of feels like you're just empowering them to be more harmful later on.
Yeah, I mean, I can see both sides of it as well. If they can make significant changes, or even, I guess, little changes, to make it less harmful for them and have less harmful consequences, then that's a good thing. Um,
Mhm.
I think a lot of the major treatment centers like Hazelden, and, like Hazelden Betty Ford, now that's it's called that, but, they want abstinence. That's
Mhm.
their goal is to have someone be abstinent.
Yeah.
I know we've been talking about addiction in terms of like substance abuse or usage, but wanted to bring up a topic regarding behavior addiction. Like I'm guessing like gambling or like social media, internet, like gaming,
Over
shopping. Yeah. So is there any correlation between two where like you can have different like recover stages to go through, or it just
I don't know the answer to that, though I know that they do differentiate between the behavioral or the, like, physiological addiction.
um,
Um, I know that, they also categorize addiction and, well, overdose more into intentional or, unintentional. Like, say someone just doesn't know that a couple of the medications they're taking don't ma you can't take them together. Maybe they overdose
Mhm.
on that, or because they take too much heroin or, whatever. Well, intentional are considered suicide attempts. Um, so, maybe just someone's having a hard time and so they decide like, "Hey, I'm gonna, you know, shoot up more heroin than I usually do," or whatever the case may be. But you know, with addiction, since it is treated as a medical disease, um, most places do recommend abstinence. So, they approach it like they would, like, treating diabetes or treating some other disease because it's in the same category. And, it's also in the DSM. So it's also considered a psychological disorder, but primarily a medical disease. So people approach those differently.
Yeah. I mean, it's also like this is just me being selfish, but like if I was going to a rehab center and or if I was sending somebody I love to a rehab center, um, I would not want to come back or for them to come back, you know, a little bit further on the journey. Like I want them to come back like good. Because it's a huge
It's a huge
it's a
expense.
huge undertaking. Yeah, and it's a huge expense, and you don't want to feel like, you know, you put all that effort into it, you put all that work into it, and it's not, and you haven't finished the journey towards sobriety or whatever it is.
Yeah.
So I can absolutely understand that. I can also understand that there are a ton of people who go to these facilities and then relapse. Um,
Oh, many times. That's the norm rather than the exception.
yeah, that's I mean that's really unfortunate. I had a friend that went through the whole like rehab, AA, all of that stuff. And he was telling me, this was years and years ago, but
Yeah.
he was telling me that from his understanding and speaking to all of his fellow addicts and people in recovery, that uh, addiction is basically people, and I've probably said it on this before, but addiction is basically people trying to self-medicate and doing so to a point where they don't know how to live without self-medicating. And he was saying that that's what one of the things that's so difficult about recovery is like addiction becomes part of your life.
Yeah.
And that uh, when you're sober, when you're trying to be sober anyway, um, you're you have all these things that you no longer can do, and so you're trying to fill that void and you don't know how. And so
Yeah.
you end up finding a new way to self-medicate or just going right back to the self-medication that you had done previously.
Yeah, and I don't think it's always self-medication. I mean, I think some people just start out doing it because they think it's fun, and then, and it's a way to, like, maybe help them socialize, they relax, at a party if they have a couple drinks, or then it gets to the point where they can't just have a couple drinks. Um, that turns into, like, 4, 5, 6 drinks, or even more. But I was gonna say, with the average relapse rate is 4. So, insurance pays for, um, a lot of it, depending on what insurance you have, but it's still, that's like for a 30-day program, and
So
it's still. Go ahead.
when you say the relapse rate is 4, does that mean you're likely
And
to relapse on average 4 times before you find sobriety?
yeah, or attend treatment 4 times because you did
Oh, wow.
relapse. And people for treatment these days don't view it as, like, a negative. They're like, "Well, we expect that you are gonna relapse at some point. We don't want you to." They're not, like, trying to, put them down and make it negative, but they're like, so if you do, it's an opportunity to learn about what was going on in your life then, and for us to, maybe take a different approach, so it works better for you. Because there are different treatment approaches. Um, but yeah, and I think so many more people would go if it was more affordable. I mean, for such a big problem and such a big public health concern, they don't make it accessible to a lot of people.
Yeah. I mean, I can I can speak for especially rural communities, where, you know, like I was born. Uh, Addiction is baked into the community, in a lot of places, and I can't speak for other communities, but the the place where I was born, it's baked into the community. You know, like you know an addict. Everybody knows an addict, and it's just, well, you know, that's part of life.
Like,
And
who that person is. Yeah.
what I've seen is that the the addiction doesn't seem to change, but the drugs do, if that makes any sense. Like people still become addicts. Some people stay manage to stay away from it their entire lives. Some people dip a toe and are fine. Um, but there's always, not always, but there ends up being a new drug. Like when I was really young, a lot of people were doing crack, and then it became meth, and then now apparently it's fentanyl, which I don't know nearly enough about um, to comment. But there always appears to be a new drug, but the underlying addiction part of it is still there. It's still the same people. It's still the same groups of people.
Yeah. Well, with fentanyl, there is fentanyl that's used for medical procedures. So and it can be like a patch or liquid or like, in an IV, and it's safely used, especially for people with chronic pain. Um, but then there's like the street fentanyl, and a lot of times people mix that in, they like cut cocaine with it, or they mix it in with like, heroin. And it's such a small amount is like deadly. A teeny amount, if you're taking the street kind, is deadly. So now they have fentanyl testing strips. So if someone buys like cocaine or something, they can test it to see if there's fentanyl in it. So, I mean, I think that's a good idea. If people are going to do it, you want them to, have the least amount of risk.
Is there any cultural like stigma around it? For from understanding from my behalf, right? Coming from a third world country, like I've seen my family members talk about, oh, like, hey, this person's got a alcohol addiction or some type of substance abuse. But at that point back then, they had no clue where to go, how to contact anyone. And this is again back at home. And I feel like from your guys' perspective, and then like Aaron living in the rural world in the US, and Tracy on your end as well, like, have you seen there's more opportunities to go to a rehab center over time, or like America has been providing that?
I think there's more opportunities here to go to, though I'm not overly familiar with treatment in a lot of other countries, but
Hmm.
I know there are a lot of opportunities here. I don't know how those compare to other countries, but
Hmm.
especially if you need to detox, that's, rehab is like, you have to be medically supervised if you're detoxing.
Okay.
So, and some detoxings are much more painful than others. Like I've read that opioids and benzodiazepines are really painful to get off of.
Okay.
So, anyway, I think someone asked a question.
They did. Um, So I want to know, is any type of addiction related to mental health issues like childhood problems, anxiety, or any other mental illness? If yes, what could be the possible ways to cope or recover? From personal experience, yes, like 100% yes. Uh, to that, I never developed an addiction to hard drugs or anything, but and I actually talked about it last week when we were talking about overdose. Um, but I did just down energy drinks and caffeine and things like that when I was in my early 20s. Um, that were now in hindsight knowing more about specifically my ADHD were just me trying to self-medicate because if I have enough stimulants in my body, then I can focus more and I can perform versus, kind of being all over the place sometimes. So there, for me, and I can only speak about me, but absolutely there's a tie-in to mental health issues and there's a tie-in to, you know, personal problems as well.
I agree. I knew someone who had a very chaotic, conflictual home when they were younger, and it created a lot of anxiety. And so he would drink because it helped quell the anxiety. And the same, like an example I gave before, he'd have a couple drinks, then he'd feel great because he relaxed, but then he couldn't stop. So like after the second drink, he's like, okay, this is where I should stop, but he couldn't. So, and he had a lot of childhood problems and affected his mental health completely.
To get to the other side of the question, first off, I whatever my answer is probably wrong. It's just in my own experience and with people that I know and friends and family and things like that, as well as myself. But what ended up being very helpful for me is as a lot of my friends, because when I was in my early 20s, like I was drinking and all the time, and a lot of my friends ended up uh, going to AA or having alcohol addiction problems. But what ended up kind of, I don't want to say saving me because I don't know where it would have gone with me, but what ended up being really beneficial to me were other positive habits that I developed alongside this.
Yeah.
Um, like I used to run every day back when I was a heavy drinker and doing a ton of energy drinks as well. Um, and at a certain point, I started to get hangovers, like really bad hangovers. And I had to choose between, hey, do I want to stop running or do I want to tone back how much I'm drinking? And I ended up choosing, I want to tone back how much I'm drinking. I kept drinking for a very long time. I kept drinking a lot, but it kept me from going into that blackout phase of like, hey, I'm drinking to the point of blacking out almost every night or multiple times a week or whatever, because I always wanted to be able to run the next day, or I always wanted to be able to be active the next day. And sometimes, like if you're in that situation personally, I found that having something else to take the place of your time that you want to do as well, it doesn't stop it, but it stops it from growing, if that makes any sense.
Yeah. And one of the major things people work on in rehab is, and you mentioned earlier, like if you're taking away all the time that they did drugs, they pursued getting drugs, they recovered from drugs, they now have a lot of free time on their hands. Um, so yeah, you do have to fill that void with other activities because otherwise people get bored and they're like, this is so boring not using, and you go back to their old habits.
Yeah, get a hobby. Um,
Yeah.
but like it's true because I mean, in the community that I grew up in, like there's nothing to do. You can go bowling, you can go see a movie, but movies are super expensive, and most of the bowling alleys have closed now. And people sit around, they'll watch TV, they'll get bored, and inevitably somebody goes, "Hey, you want to go get effed up?" And people go, "Yeah, that's great. That sounds like fun." And quite honestly, like that's how it starts. It seems very innocuous. It seems very simple, but
Mhm.
like, uh, what's the phrase? Idle hands are the devil's playpen. I think that's it. I don't know, but
Yeah. Oh yeah.
that boredom can be a huge motivator uh, to consume whatever substance is your poison of choice.
Yeah. Yeah, and you mentioned like rural areas and smaller communities, and there that's where a lot of people were making meth in these rural areas in different parts of the country. Like I know it was really bad in Ohio and it was bad in Missouri. And then you look at the opioid crisis, and that started. It really got worse in like the middle Atlantic kind of states, or inward, like Kentucky, Tennessee, West Virginia. Some of those were hit very hard with the opioid crisis. And I don't know if you've ever read, or seen the book, or there's a show on, I think, Hulu or something called Dope Sick with Michael Keaton, and it's about the opioid crisis. It's really well done. And it just gives you a glimpse into how this just ravages people's lives. Not only like because some people die, but they end up stealing. They get their family. It's like you're an outcast, and we're not going to deal with you, or you know, they spend so much time looking to procure the drug that they can't do anything else. They can't hold a job, you know. So that's a major and most well, I know most overdoses in the country, like 7 out of 10 are from opioids. It's really a big problem. But they also have
I
Narcan for opioids. So that is at least something you can do to help someone when they're going through like opioid overdose. I don't know if people are familiar with the Narcan, but you can either do it nasally or you can do it in like their thigh. You can do a nasal spray, or there's like a little needle, like a syringe basically, you can do in their thigh, and it reverses the effects of their opioid overdose. So it saves a ton of lives. We had to have it when I worked in corrections. Um, I've worked at some other practices where there's a lot of substance abuse problem, people coming in, and we had to have it there. So at least that's one promising thing, that at least if someone's going through that, there is a way to kind of reverse it.
On that note, Dr. Sultan, I feel like there are so many studies and research on why substance use or addiction is bad for you and what it does to your brain. But there's also on the reverse side of things, what you mentioned is like stopping that can also, you know, reverse the whole thing. Like it can make, memory better. So is there anything on that? Because I read a recent article by Washington Post on how does alcohol basically, like, if you stop drinking alcohol and what it does to your brain.
Yeah, I mean, they say with a lot of the drugs that, like research says that if you stop them within like, a week, you can think more clearly, or, your cells are repairing themselves, or things like that. Though some people have, especially say like alcohol, um, have continuing problems like, you know, um, they'll have the delirium tremens and they won't go away even after they stop drinking. And that's like when you shake your hands shake a lot. And when you have another drink, then that goes away. Um, and then there's also tardive dyskinesia, which is a movement disorder where, I mean, and they call it wet brain as part of the vernacular for when you describe someone who has some of these problems that persist after they stop drinking. And like tardive dyskinesia doesn't go away. And that's when you kind of like shuffle, and your mouth makes, like is moving a lot, and you're like your um your tongue is like on the top of your mouth a lot. So it's like I heard someone describe it as it's like chewing gum for like 8 hours. And while it's like you just want it out of your mouth, but like you can't get it out of your mouth. So, but ultimately it does, affects people walk the way they walk, and it's pretty serious. I mean, you can also get that from taking certain psychotropic drugs too. They have like black box warnings, such as like Abilify, Risperdal, Seroquel.
very scary.
Yeah,
Sorry that that sounds uh no fun. I mean,
yeah,
I think on a certain level, a lot of people, myself included, start using substances because they're fun. They make you feel better. Um, and I think that for, and I could be wrong, but I think for a lot of addicts, it gets to the point where they don't know how to have fun. They don't know how to find joy um, any other way, you know? And that's, to me, I think that's part of the root of recovering from addiction because you have to build a new life depending on uh
Right.
how deep into it you are. Um, and it, you talked about 4 times going to rehab is the average. Like that kind of makes sense because the first time you try, it doesn't stick because there's other things, but you're a little bit more prepared. The second time you try, it doesn't stick, but you're a little bit more prepared than you were the first time, and so
Right.
on and so forth. And eventually, you have the all the parts of the new life that you need in order to keep going with it. But like, it's a monumental undertaking.
Yeah.
Um, I think that one of the things that to me makes addiction uh, so terrifying is that depending on the addiction, um, but especially like opioid addiction, uh, is that it can really feel like a moral failing if you're with if like if it's a close family member or if it's a close friend, because what I've seen with my own family with opioid addiction is that everything and everyone takes a backseat to the addiction. They will, depending on how bad it is, they might steal,
They lie
lie,
all the time.
whatever, and it's it is very hard cognitively to accept that it's entirely the addiction that's doing this because you're working with somebody that you're hanging out with and you're being with somebody that you've trusted, you like, have uh a good opinion of, maybe in a lot of cases for a lot of people it's somebody that they love. And when they have put you, whether it's stealing, lying, whatever, but when they've put you in a backseat to their addiction, it feels like a betrayal, like a massive
Absolutely.
betrayal. And it is a very difficult cognitive task to not assign that to a moral failing, to
Well, there's a
not
lot of
go to
collateral damage with, addiction. With your family, your significant other, losing your job, um, getting arrested, having health problems. It's like at what point, my ex-husband was addicted to alcohol and then cocaine. And, before we got divorced, I said, what else do you have to lose before you think about stopping? And people always say like when they hit rock bottom, that's when people, seek out treatment. But I don't know that that's necessarily true. And he's been to rehab 7 times.
that's rough.
So yeah. And he lied all the time because all he wanted to do was get the drug or get the alcohol. So that was the most important thing in his life. So yeah, it's not easy.
It's and we have a question that I want to get to, but I want to finish up this part of the conversation. Um, and I think it's also like even if they recover, the damage that's done to the relationship that you might have with them may not be recovered.
Absolutely. Many times it's not
Like,
salvageable.
I have a family member who got really deep into opioid addiction, and they ended up recovering, and they ended up, I think at this point they're like 15 years sober. Um, But there are still members of my family that will not talk to them, will not have anything to do with them because they're just like, "Nope, you went too far, and I'm not dealing with that." Um,
Yeah.
and, it's sad, but on a sense, like, I understand where they're coming from because it's a lot to get over. Um, that being said, we have another question. Uh, Replacing habits from bad to good is effective in many cases, but how can you solve the root problem, which is still driving you into the addiction again? Replacement isn't the full solution, I guess. 100% on that.
Yeah, and I think they're typically is a root problem. Well, but also alcoholism, it has a very strong genetic component, very, very strong. So yeah, it's I think a lot of treatment centers offer a lot of mental health in addition to just a substance use disorder treatment. They offer mental health treatment as well. And that's really important to work together on those two.
Yeah.
With someone with an addiction use, like I feel like you have to be close to them to help them. But what if they're like in a different country or a different state? Like how can you solve that? Or how you can like resolve that type of situation? Or you have to be like something like near someone like, 24 hours, 7 days a week.
I think so. I think that,
But
now with technology and Zoom and other ways to talk to them and, loved ones can call a rehab center and say, I'm worried about this person, try to like do the legwork to get them involved so they don't have to do it. And then they would obviously go in for an assessment and stuff. But I think there are ways to help someone if they're not, living down the street from you.
Yeah. I think it's definitely, you know, to me, setting people up for success. Like ultimately, the addict has to decide to stop being an addict,
Right.
but you can provide them all the tools that you are able to provide them from where you're at and work with them as much as you can to get them there. Which is really all we can do, regardless of the situation, whether it's addiction or somebody's just being a jerk or whatever. Like all we can do
Yeah.
is give people the tools to change and hope that they do. I do want to circle back to Mal's question about replacing bad habits and root problems. And I wanted to bring up something
My
that
maintenance people left, so I'm going to my office. Sorry.
no worries, but something that I heard when I was going through counseling for my own family stuff. Uh, Somebody said something along the lines of happy families all look the same. Unhappy families are all broken in their own unique and special way. And it's kind of, in my opinion, and please feel free to correct me, Dr. Tilton, if I'm just way out in left field here, but it's kind of the same with addicts or with mental health disorders or struggles is, you know, when you're functioning and you're capable, it looks the same. It looks like everything else. When you're struggling, why you're struggling, how you're struggling, the path toward not struggling is unique to you. And kind of going back to what we were talking about with Robbie's question, all you can do is set people up for success in that path and hope that
Yeah.
they take it. But they have to take it, and it's not a straight line. Like I've never
No,
heard of any
it's
recovery
not
that is a
linear.
straight
No.
line.
Mm-mm.
Um, but like it's one of the AA mantras, whatever, is one day at a time, and that's really kind of I think very helpful, especially for addiction, but for recovery in general, is looking at things kind of one day at a time, one step at a time.
Yeah, and AA serves a lot of people in a very good way. Sometimes people say that it's like treatment, and so they'll go there in lieu of treatment, but it's not treatment. It's because there's no intervention, but it is a support group that does a lot of people a lot of good. Um, but there's other approaches, like if you're going to treatment, then you can take medications that negate, like, say like disulfiram with alcohol. It's also called antabuse. And if you take it and then you drink, you get really sick. And there's some drugs like that for other substances as well. So, I mean, if someone wants to take like Suboxone for opioids or um, like the Narcan or naloxone, change it so like the drug doesn't like bind to your receptors. So you don't get the pleasurable feeling from it anymore. Because like the reward center and is like dopamine. And if you're, eventually you're not getting as much of that. So then people do more and then they do more just to have the same effect as they used to. And that's really dangerous. I mean, that's called tolerance. And in the DSM-5, they used to always have abuse of substances and then dependency of substances, and now they just kind of lumped them all together. So there's just one category. So that was a big change from the last DSM, but definitely it does have a lot of psychological impact on you as well as the physical. So whether you decide, sometimes people are like, we have to do your substance treatment first, and then we'll do your mental health. But I know, like at Hazelden, they do both at the same time.
And that makes sense because um, you know, I think everybody who got there on their own terms, and unwinding that uh, is a process. We do have another question that I wanted to put up. I have a kind of philosophical question, like who would you blame for addiction? The addict, the situation, conditions?
I would say, I don't know if I would use the word blame, but I think you can say all of those might be related, have a correlation with addiction. Maybe not causation, but a correlation. Um, because yeah, I mean, if your family was very conflictual and you were scared all the time, or um, you know, didn't ever want to be at home, and so you would go. Maybe your parents weren't really monitoring who you hung out with, say like in high school, and you started hanging out with people who did drugs at a young age, or were engaging in other bad behaviors like illegal activity or whatever. Then you might start, say they did a lot of drugs, and you might start doing that too. 'Cause, like, you didn't wanna be at home, or, you just had an adverse childhood experience.
Yeah. I think it goes back to what we were talking about before about, everybody has their own path toward addiction and their
Yeah,
own path out of addiction. There I have met one person, not a bunch of people, one person who actively chose to become an addict. They were basically going through, and even then, there are some extensive, potentially extenuating circumstances, but they were going through a situation where they just kind of didn't see the point of their life anymore. And they were like, all right, well, I'm going to do this because this seems like a better solution than me trying to live my life. Um, and you know, in that circumstance, I would say to use the word you used, yeah, you can assign a certain level of blame to the addict, but even then, they were doing that in response to the situation that they were living in.
right.
They didn't say, "Oh, hey, I'm going to become an addict because my life is great and I think it's going to make it even greater." Um, but
Yeah.
everybody gets there in their own path.
When I was the lead psychologist at a prison in Arizona, I had to have multiple talks with the warden because the heroin problem there was so out of control. They had drones, dropping it off in the prison yard and stuff, and, um, meth was it was kinda like in one unit, it was all heroin, the next unit was, like, all meth, and, um, and, like, spice and things like that, like synthetic drugs, that's a synthetic marijuana, um, but, yeah, they were overdosing because they were bleaching needles thinking that sterilized them, and then it's just when they're injecting, it would caused, abscesses and horrible things. And then they'd send them to mental health because they're like, obviously this person's trying to commit suicide by doing this. And, maybe they were, maybe they weren't, but they did, when I would talk to them, they'd say, well, I don't care if I overdose because I don't want to be here. It's terrible to be in prison. So they're like, if I'm here, if I'm not here, they're like, doesn't matter to me really. So that's why they just kept doing it over and over.
Yeah. I think one of the things about like serious substance use problems is that for a lot of people, substance use problems replace all of their other problems with one problem. At least this is what I've heard. And that one problem is, how am I going to get high next time?
Mhm.
And for some people, living in certain situations under certain conditions, whatever, that is a preferable single problem to have than the problem set that they might be dealing with otherwise. So I tend toward, looking at the situation, but also I am not a clinician. I just happen to know a bunch of addicts, unfortunately or fortunately. Um, but yeah.
Yeah, and if you grow up in a household where everyone's like drinking and doing drugs, then you're gonna, you're gonna interpret that as it normalizes it. So then, if you do it, you just think, well, that's just what people do. When people get upset, or when people, when we're celebrating something, we all drink. When we're sad about something, we all drink. And like every other, when it's Christmas, we drink. When you can just go on and on with to give yourself excuses why you're drinking
Yeah.
that are
Especially
situational.
alcohol. It's so easy to normalize that.
Yeah.
Go ahead, Robbie.
No, I was gonna say exactly. Yeah, I feel like my friends have the same mentality of like, oh, like we haven't seen each other in a long time. Let's drink. Just an excuse to drink. So
Yeah.
I'm at
People can
a
come
point,
up with all kinds of excuses.
all type of excuses. So we're like, I'm at a point where like, oh, I kind of want to avoid certain situations where like I don't want to drink. Yeah.
Yeah.
You know.
Yeah.
No, I mean, like in terms of that, like, how do we recover? Would be the next question to ask.
How do you recover from
From
addiction?
addiction, yeah.
Mm. Well, it usually requires treatment of some kind, whether you're doing outpatient or inpatient. Um, there's very specific confidentiality rules related just to substance abuse that are different than other ones, like who you can tell and what you can tell, which is kind of the same as other confidentiality, but there's very specific ones for substance abuse. Like you can't tell someone's employer. Because I mean, they might guess if you're like, I'm going away for 30 days, but they also, maybe they don't know. Maybe there's a way to get around that. And so you can't tell them because you can't be fired because of substance abuse reasons. I mean, if you do something like horribly wrong when you're using, then you can, but like they can't just because if you haven't done anything wrong, your performance hasn't suffered and you are like, I'm going to go to this. They can't fire you. Now, I know some people when they've got back said like, oh, they found an excuse to fire me once I got back. But, legally they cannot.
I mean, overall, it just seems like an expensive thing to be addicted to something. Like your relationship causes issues with anyone that you're close to. So many personal problems, health problems, being addicted.
Yeah, and I know we have a question, but I just wanted to add that in the example I gave about my ex-husband, I saw his father at one of his brother's like art openings or something, and his dad said to me, he's just finished his 7th time in rehab and he's still drinking doing drugs. And he said, "When do I quit paying for rehab?" He's like, "I don't want my son to die." He's like, "I really do not want my son to die." He's like, "But how much more, when do I stop helping him?" And I thought that was a great question. I had no idea what the answer was. So, but it was a good question.
That's a really tough question.
Yeah.
Uh, Especially because like I fortunately have not met one to my knowledge, but I have heard stories from family members and friends and things. Like there are some addicts who just there is no rock bottom.
Right.
Uh, there is no point of hey, I need to straighten my act or whatever. It's just the addiction is always going to be the most important thing, and
Yeah.
any recovery is just to facilitate the next time that I can make it easier for me the next time that I can use the substance, get high, whatever it is.
Yeah.
And like the show Nurse Jackie, I don't know if you've ever seen that one,
Yeah.
but
I love that. That's a great series.
that show like ends up horrifying me as it goes on because it's just like you're watching this person continuously put her addiction above everything else. And like slowly but surely she, uh alienates everybody from her life, but she finds new people to bring into her life to facilitate her addiction.
Right.
Um and like for people who have experience with addicts, like that show is horrifying on a certain level because you're like, yeah, like I could absolutely see it going the other way. Like for me, friends, family members have all gotten help where I'm not particularly worried about them harming themselves or others, at least to a certain extent. Some of them are still using, um, but not like that. But I've definitely had some where it's like, ooh, this could have easily gone that route.
Yeah.
I mean, sorry, I have construction going on in the background, but what would you say to someone who's in disbelief of their addiction, right? Where they can't tell a difference between, oh, I'm just casually drinking, which they do every single day, right? Drink with their dinner, or in disbelief of like, okay, this is actually an addiction.
Well, denial is very strong.
Hmm.
And a lot of times the most difficult part is guiding someone out of denial. Because until they're ready to work on it, it's not going to happen. So I think just, like letting them know, like, well, this is what I've observed, that you've lost everything important in your life. You've been to jail, you killed someone in your DUI accident, all the stuff. And, they have to realize, this isn't working for me in any way, shape, or form before they're ready to address it in a treatment capacity.
Yeah. The first step, uh, at one point I used to know all 13 steps, but I know that the first step is admitting that you have a problem.
That you're
And that
powerless over
is,
it or something like that. Yeah.
yeah, yeah. And that is for everyone that I've talked to who's gone through AA, that is the hardest problem step for them was
Yeah.
acknowledging like, hey, I do have a problem and there's no, oh, I can slow things down or oh, I can control it. It's I gotta stop. Um
Yeah. And the
and that's
step
a
where you have to apologize to people for everything you've done to them. I think a couple of my friends who stopped drinking and were going heavily involved in AA were like, I'm dreading that chapter or that step rather. Um, so
I've gotten those calls uh from friends and family members. I've gotten them when I've been like, oh, I didn't even know you did something to me. I'm sorry.
right.
But I've also
You're like,
gotten them where I'm like,
what?
yeah.
Yeah. You're like, I wasn't mad before, but I'm mad now. But that would be a very difficult step, I imagine.
Yeah. Well, This was a great conversation. I just happened to look down at the time and realize that we're out of time. But thank you both so much for joining us. Thank you to everybody who watches this or will watch this. Thank you to Mal for the great questions. Thank you to LAMCO Wellness for sponsoring this. And I hope that, you know, you've taken something away from this and can respond and react to addiction in a more healthy manner in your own life. We'll see you next time. Thanks.
Bye.
Thank you.